Good morning, I am Dr. Sireesha Reddy, Consultant Obstetrician Gynaecologist from Motherhood Hospital's Hebbal. Talking about minimal invasive surgery or minimal access surgery, which is commonly known as, or for the normal community we call about endoscopic surgeries or laparoscopy, hysteroscopy. These are all termed under minimal access operations or minimal access surgeries. The benefits, when you talk about what is the benefit of minimal access surgery, is the doctors use very small incisions to perform an operation that is needed for you, and because of using small incisions, your chance of developing infections, your chance of having higher blood loss are less, and when you're talking about your recovery period, that is much more faster with a minimal access surgery, because the cut is extremely small, does not cause you any discomfort or pain while you're walking, moving and doing your normal activities. So sometimes you would have heard about it's like you get the surgery done and go home to watch your favorite TV show. It's more or less something similar to that for most of the procedures that we do through minimal access. So when we talk about what all can be achieved with this minimal access surgeries, especially with gynae point of view, you're talking about, we do perform what is called Diagnostic Laparoscopy and Hysteroscopies for fertility evaluation in women who are needing to analyze or assess their fertility potential. And we also perform what is called laparoscopic sterilizations, where women are seeking for family planning operations through a minimal access route. And we do what is called laparoscopic recanalizations, where we tend to connect the tubes that have been disconnected due to their operations, and they're planning for more children and they would want to continue carrying on with the pregnancy. And there are surgeries that are performed laparoscopically for major surgeries like hysterectomy, where you've been found to have a problem with your uterus. May it be uterine bleedings, may it be fibroids, may it be cancer related surgeries also are performed laparoscopically also when you have a uterine cancer. So this removal of a uterus which is up to 16 to 18 week size is easily possible through laparoscopic route, and sometimes other procedures like removal of a fibroid. You just want a fibroid that is sitting inside the uterus to be removed. That is also done laparoscopically. Removal of an ovarian cyst. There are sometimes cysts that develop in the ovaries and in your para-ovarian organs, para-ovarian tissues. Those need to be removed. That are removed laparoscopically as well. And we do sometimes we get across women who have got a prolapse, which is the uterus and the cervix is moving down in the early years of their life. When you're talking about 30-35 years also, we have some women having prolapses. So these women can be helped out with something called sacropulpopexy or sacrospinous fixation is what we do, where the uterus is pulled up and hitched to a bony ligament part which is inside the abdomen. That is also done laparoscopically. So basically, as we were talking about benefits of laparoscopy, is all extended onto all these major procedures as well. In major procedures, obviously you look at blood loss being more, risk of infection being more, because more open the wound, the more extended the wound is. You tend to notice more chance of infection getting in, more chance of bleeders that are exposed, and they tend to bleed and all. So all these things for major surgeries, and they do take a little bit of a long time also, major surgeries, when you're doing it on an open fashion. You tend to notice infection rates are more. So all these things can be avoided in a laparoscopic surgery. So cosmetically it is beneficial, recovery wise it is beneficial, and you feel more confident. Basically you feel that during your recovery phase you are not dependent solely on others to help you out and all. So in that way it works out well for you. Surgical point of view, whatever has to be done in an open surgery, a lot of people tend to get this idea when they come and ask us, the way they think that when we do it laparoscopically, because we are using small incisions, small instruments, probably we do not remove whatever we have to do it completely. It may be partly done, but that's not true. Whatever has to be done, whatever the surgery that is deemed to happen in an open way, the same thing will be done in a laparoscopic way as well. And the other procedures we can do with other method of this thing which is called hysteroscopy. Hysteroscopy is to evaluate. This is like completely no cut, no incision procedure. We use the natural passage which is called cervix, through which we go into the cavity, check the cavity, see how the cavity is. Sometimes you may be having what is called polyps, fibroids within the uterine cavity that are causing problems like irregular bleedings, intermenstrual bleedings, painful bleedings, or while you're planning for a pregnancy, them being inside the cavity are not an ideal thing, and the doctors would have suggested you to get that removed. All these things can be removed hysteroscopically. And you may be having what is called an extra wall, which is a thickened wall which is called septum inside the uterus. This can be dissected hysteroscopically, and we can take care of making sure that the cavity becomes into a uniform shape. So these are all procedures which are done hysteroscopically. When we say hysteroscopy, there's completely no cut. It's pretty much the same day going home type of surgery. And yes, you do tend to notice that it is much more easier than getting to an open surgery for those procedures that have to be done inside the cavity of the uterus. So when you're talking about is everyone an ideal candidate for laparoscopy and hysteroscopic surgeries, it is very important, yes, to have this discussion with your doctors also. Sometimes all procedures may not be capable to be performed laparoscopically. Like you have large multiple fibroid uteruses, extremely large, extremely big, and access is going to be extremely difficult with these laparoscopic instruments and all. Those are the times that the doctors would tell you that no, that is not the route, and the best and safe route for you would be an open surgery. So at the end of the day, how do we assess going through this offering you minimal access surgeries? How healthy are you? Are you fit to undergo an laparoscopic procedure under anesthesia? Because it will be a general anesthesia that will be given to you, which would take up to 2 to 3 hours depending on the type of procedure that you are having. And also we assess the duration of the surgery that would be, the duration that would be taken for performing the surgery through laparoscopy. Sometimes you may be having extremely multiple fibroids, and then we find that removing those fibroids, shelling them out, making them into small pieces, removing, stitching and all, if it is going to take long and we think that the duration of surgery is going to be extensive for you, then at a certain point of time, we sit and assess with you and discuss with you, sit and have a chat with you, asking you that open route may be a better option for you. So the doctors would look into what is the ideal condition for you. So not all of surgeries can be performed laparoscopically, but majority of them should be able to be performed laparoscopically is what I would say. So, and proper assessment is very important, not with the doctor, with your obstetrician and gynecologist, as well as with your anesthetist. The anesthetist also need to evaluate you whether you are a right candidate, check your lung and heart function and all, and see how well you are, and check your for staying under anesthesia for such long procedures, whether you are a fit candidate and all. All these things are taken into consideration before we offer. At the end of the day, what we would want to do is do a safe procedure for you, ensure that you are safe and you go home safe and have a better outcome. Thank you.